Hi, this is Dr. Baruti at Get Well Urgent Care in Douglasville, Georgia. We're going to do a quick in-service on using the incentive spirometer. These are our Snap Smart medical assistants, Paige, Daisy, and Keita here. Okay? So you'll notice sometimes that when the providers come out of the rooms, when patients who have pneumonia, we think have pneumonia, or at risk of getting pneumonia, will order an incentive spirometer, okay? If you remember how the lungs are made, you have a series of tubes that can come off of the trachea, then you have your bronchus, your bronchi, then you have several more branching to where you'll end up with 300 million little air sacs called alveoli, and that's at the bottom of your lungs. So that's where gas exchange occur in the alveoli. If you block the alveoli with mucus, or block the little lung tubes that lead to the alveoli, the bronchioles with mucus, then oxygen can't get to the alveoli for gas exchange, and the person will seem out of breath. If it's a child, they'll be in respiratory distress, or they'll breathe fast, and that's called tachypnea. You'll hear them breathe, which you should not hear people breathe. Or they'll pant, and humans shouldn't pant. They'll have nasal flaring, or they'll have retractions where when they breathe above their clavicle, you'll see the skin going in, or under the rib, the subcostal area will retract. For children, that means that they're in respiratory distress and they need a hospital, okay? So, but adults, they'll have a low pulse oxygen, just say, I'm out of breath, I can't breathe. When you listen to their lungs and you hear coarse bronchi, a lot of snot in the lung tubes, the doc may come out and say, I want them to have an incentive spirometer or to go home with this. So the act of the lungs, the alveoli collapsing on themselves is called atelectasis. Atelectasis, okay? The edge of the alveoli collapse. You can pop them back open, okay, by inducing negative pressure inside of the chest, and that's what this is for, okay? So you instruct the patient first how not to do it, okay? So you tell them, don't blow into this device, okay? It's not a peak flow meter, so incorrect. Nothing's happening, okay? So that's how you don't do it. Another way that you tell them what not to do is to take little puffs in. They'll do that too. You tell them don't do that, okay? So the proper way to do it is the patient should sit up, hold the device where the tube is horizontal, empty out the air from their lungs, form a tight seal around. You set the goal where they should be getting the plunger up to, and tell them, look at the quality indicator and keep the indicator in between the two arrows.
They're going to take a normal breath, basically.
So the breath, I wouldn't call that a normal breath. It's a very deep breath. And then you hold the breath while the plunger drops back down. So you hold it open for about 6 seconds, okay? And that's one iteration, okay? An iteration just means one time that you do it, okay? And you have them do this 10 times every 1 to 2 hours that they're awake, which is about 100 times a day. So this is how you teach the patient to use the incentive spirometer. It's one device per patient. You have any questions?
So how many times should they do it, like while they're in office?
Just enough to show them, to demonstrate. So you can open up a package, and this is one device per person, so no one else should use their device. So you just have them demonstrate. Now usually in the office they're sick and they're coughing and they have a lot of mucus in their lungs. So when they do it the first time in the office, they're going to cough and not want to do it, you know, in the future. But you just tell them, we're treating you with whatever our treatments will be, whether it be steroid or breathing treatment. So when you do this at home, you're not going to cough all the time, okay? But encourage them to use it. This little cheap device can keep a person out of the hospital with pneumonia.
I was going to say, is it safe to say this is treatment for patients with pneumonia?
So Daisy's question was, is it safe to tell patients that this is a treatment for pneumonia? This will help people who just had surgery, chest surgery, who don't want to take a deep breath and they are used to taking shallow breath. This will help them not develop pneumonia. But for people with pneumonia, this is also helpful. It'll make the medication more available in the alveoli when they take their antibiotic or their steroid. So this is used both to prevent and to treat.
Okay. Now, what if it's not effective? Like you said, that they need to do it at least 100 times at home.
Mm-hmm.
What if they
A day.
come back a day? Right. What if they come back in and say that it wasn't effective or it didn't help, and they still have the same?
In 16 years of practicing medicine, I've never had that happen.
Okay.
Okay. And so if we're using this as an adjunct to treat pneumonia, there are other things that we're treating them with. They have a nebulizer, using albuterol, Atrovent. They have a steroid. They have an antibiotic. So this is just one part of their treatment.
Okay.
So they never just rely on this.
Okay.
But I've never had anyone bring it back.
Bring it back. Okay.
Okay, so that's our medical minute here at Get Well Urgent Care. So tune in next time and we'll be discussing a different topic. Thank you.